Okay, 7 sounds good. Bye. Hi, I'm Sydney. If you're like me, you know that life as a teenager can sometimes be busy. School, sports, dating, working, and peer pressure can make our lives hectic and stressful. Now, imagine what it would be like to find out you need to go to the hospital for surgery. Waiting and worrying about your surgery can make an already stressful time in our lives even more difficult. You have so many questions. Will it hurt? What if I wake up during my surgery? How will I keep up with my schoolwork? Will I be able to stay in touch with my friends? Can my parents stay with me? Will I have my own room? Do I have to wear one of those silly gowns? Over the next few minutes, we'll introduce you to some teens just like you, who once had the same questions and concerns about their surgery that you may be having right now. They'll share their experiences, and we'll take you on a brief tour of the Upstate Golisano Children's Hospital. You'll see for yourself how this family-centered facility is dedicated to the comfort and care of you and your family. So, let's get started.
I think the most difficult part was learning about your surgery and knowing that you were going to have it, and probably when you come out of surgery and all of the pain that you have to deal with.
I've kind of felt nervous about it.
Same here.
I never had surgery before, so.
I wanted to know about the recovery time, when I could get back to things or if I would be able to get back afterwards. And what procedures they were going to use, and I wanted to know who was going to be in the room with me and all that kind of stuff. Also, what was going to happen after it.
Would they mess up?
Yeah, it was their chance of this happening.
Are you going to make it out of the surgery?
Yeah. It was kind of uncomfortable because I was so used to being in my regular clothes. When I got into a gown, I really started to think about, it's really happening now.
But in the preparation room, at least you got to watch, a funny movie or something.
Yeah.
I watched Balls of Fury. I really do not like IVs, so I was can we do this without it? Maybe?
Nobody likes needles, nobody.
Yeah.
I was worried about how much it would hurt because it was surgery. They were going to cut into you and stuff.
I felt like I was going to wake up, and I was worried that I wouldn't see it.
That's why there's an anesthesiologist that you get to know. They keep you sleeping. That's their job throughout the whole surgery.
Believe it or not, with some preparation, your surgery at the Upstate Golisano Children's Hospital may be much easier than you think. You can make an appointment to visit the hospital before your surgery and meet with a child life specialist. The child life specialist will answer any questions you have about your surgery and talk to you about your concerns. During the session, you'll learn about what will happen on the day of your surgery, all the people involved in your care, what kind of medicine you will be given to help you sleep during the surgery, and what to expect when you wake up.
It helped because it showed you what they were going to do and how it wasn't really going to hurt that much, but it would still be painful, but it helps understand and make me less nervous about it. So
It was pretty neat to know where to go and to see the rest of the hospital.
When they first put the IV in me, one lady told me to cough, and if you cough, actually you don't even feel the needle go into you. And if you get yourself all worked up about it, it feels worse.
they kept talking to you while you went under, which was nice. Asked you about school and stuff. So they took your mind off what was going to happen.
I was worried about being alone when I went to sleep, but what helped me was holding on to my mom's hand, and I just fell asleep talking to her.
My parents came, and they helped a lot. They were there right after I got out of surgery until I woke up, and then there was always at least one parent in my room throughout the whole day.
I kind of felt happy afterwards because I was done.
I had a morphine pump.
Yeah,
I could
morphine.
press a button,
Yeah.
some
Morphine.
amount of morphine would go in, and you'd feel, hi.
If you have to stay in the hospital after your surgery, you'll have your own private room, just like this. There are fold-out couches and chairs large enough for your family members to spend the night. Plus, each room has its own flat-screen TV and PlayStation 3. You can even bring your own computer, video games, favorite book, or MP3 player. Family and friends are always welcome during regular visiting hours, but parents can stay with you the entire time you're in the hospital.
They had actual couches that could be pulled into full-size beds. which was a lot better on my parents.
The nurses were nice, and it was nice to know that they really cared for you and they got to know you and knew what you needed and stuff, help with, and that kind of thing. All of the child life specialists were very nice. And
I had Colleen. She would even sit down and play games with me instead of keep going. She would sit down and play games.
But sometimes you just need a little bit of space from your parents, but it's nice that there are family lounges and places that they can go to give you a little bit of space and for them to have their own space too.
Yeah, the exhibits on the 12th floor are always really cool to look at. The one time they had dinosaur plasters.
Physical therapy was very hard though because they push you so hard and you're on so much medication and you're so tired. But I bet they make you. But in the end, it's for the best. So.
Depending on the type of your surgery and the length of your hospital stay, it may be hard to do all the things that you were able to do before your surgery. Your medical team will help prepare you for what to expect when you return home, and help you deal with any pain or discomfort you may experience during your recovery. Family and friends, as well as teachers and coaches, can help you through this difficult time. It's normal to be nervous. It's normal to have questions. But the important thing to remember is that when you have a question, to ask it.
When you first go home, it's a little bit scary too because you're not sure how it's going to be in your environment with your, in your condition when you leave.
I was happy to go home.
I was happy, but I had to make up a lot of schoolwork. Everyone at school was nice about it, and they didn't laugh or anything. They were all that kid's pretty cool because he went through surgery and he doesn't seem hurt at all.
When you go back, it's hard to stay away from the stuff because you want to be able to run around with the kids and stuff, all your friends, and it's hard to keep up with them, but it was nice that I could go to all my sports practices. I could go and watch dance classes and all that kind of stuff, and they were really nice about it, and they tried to involve me in everything. You should really trust your doctors, and I think that with the pain management and stuff, try to keep yourself occupied.
Try not to be nervous, but it's okay if you are, because it's a really hard thing to do for anyone. But it always helps to have people you know and never get too afraid, and always trust in the people that are helping you because they always know what's best for you and stuff.
Thanks so much to the teens who shared their stories with us. We hope that you learned something from their experiences and that by sharing they were able to answer some of the questions that you may have about your surgery. If you would like to schedule a visit with a child life specialist to discuss your surgery ahead of time, please call the number on your screen. And remember, the Golisano Children's Hospital is designed to make your surgery and hospital stay as pain-free and stress-free as possible for both you and your family. Thanks for watching.